Okay. There we go. Recording
All
away.
right.
All right, Eric, take it away.
Okay. Well, thanks, Barb. Thanks for the invitation. And our communications group at my center, I guess, reads the Mountain Times because they saw that I was going to be speaking today and wanted to know if I was out in Chaffee County. And I told them no. In fact, modern technology allows me to be there. So let me see if you can, hang on a second, if I can share my screen. Oh, there it is. Oh, it didn't work. Let me see. Hang on again.
You did it once before.
I know. We did this at 5. It'll come.
So this is always embarrassing. Yeah, we just did this a few minutes ago.
Settings, so he
Never
share?
did it. Huh?
He already did it once.
Okay.
Okay, let's try it here. Can you see my
Here
screen?
we go.
All right.
Hey, all righty.
Success. So we're going to talk about the COVID-19 emergency is ending, but unfortunately the pandemic is not. So Barb asked me to talk about where we are, where I think we're going, what we've learned. So where are we? So these are, I'll be showing you a series of graphs. These are all from the New York Times based on CDC data, and they're all current as of yesterday. So this is a graph of daily cases from the beginning of the pandemic to today. And you can see that we are down to a pretty low level, not the lowest level that we've been at, but pretty low. We have to keep in mind, however, that these are cases that have been reported. And as most of you know, most people are doing home tests and they're not being reported to anybody. So these case counts are marked under count. But let's look at some other data. So reported cases are going down. Test positivity is hard to know what to make of anymore, but staying relatively level. Hospitalized patients are going down. This is a pretty good number. Hospitals still are testing just about everybody who comes to the door. And so that's a pretty reliable number. The number of people in ICUs is going down, and the number of deaths is going down, although still fairly high. So this is the graph of daily hospital admissions for COVID. And you can see each of these curves represent different age groups, but you can see that they're all going down, particularly the top line, which is those 70 and older. And this is a map of cases across the country. Red are places that have a lot of cases, and yellow are places with relatively few cases. So you see that there are counties out west in the Midwest, isolated counties that have high rates of cases. A lot of these are very rural. Some of them are reservations, but they represent a small number of, even though they're a high number of cases for the population, it's a small number of cases. And here we are with regards to vaccinations, and this has been steady for many months now. About 68% of the population is vaccinated. 34% have had a booster. The map shows you where the vaccinations primarily are. So those are vaccinations by population in this map on the right. And in the graph down at the bottom here, you can see the number of daily vaccinations over time. A lot of vaccinations, and early on, vaccines first became available, then another little surge, but then it's really tapered off. A little bit of a bump after the bivalent vaccines, the ones that are specific for the current variants. But still, the number of vaccinations going on now is pretty limited. So COVID deaths. Lab confirmed COVID deaths as of a few weeks ago was 1.1 million in the US. But there are also a number of people who've died during the pandemic, who have died of conditions that may or may not be related to the pandemic. So we refer to these as excess deaths. So we know how many deaths to expect in a given month based on long historical records. And there have been 1.3 million excess deaths since the start of the pandemic. These include the confirmed pandemic deaths and the others. So people are still dying at a rate of about 140,000 per year, making COVID the fourth leading cause of death in the US after heart disease, cancer, and injuries. So still a lot of people are dying from COVID. And most of the people who are dying are people who are unvaccinated. So if we look at this graph, we see that back here, end of 2021, beginning of 2022, the number of people who were dying who were unvaccinated was 13 times the number of people dying who were vaccinated. That difference is now down to 4 times. Why the difference? Probably because people who are unvaccinated still have acquired immunity from prior infections. But still, the number of people dying who are unvaccinated is 4 times that of people who were fully vaccinated. There is much less strain on the healthcare system now than there had been in the past. This gray line at the top represents people in hospitals who have tested positive for COVID. Now, some of these are people who are being admitted because of COVID, and some of these are people who are being admitted for totally unrelated problems, such as a car accident, but who get tested as a matter of routine. And so this is everybody in a hospital who tests positive for COVID. There, in the bottom line, the black line, are the people who are in intensive care units. And for the most part, these are people in intensive care units for COVID. So that's remained pretty flat at a pretty low level now for quite some time. And the number of people being admitted to hospitals who test positive is going down as well. So now, one of the major issues is long COVID. And we have a lot of trouble with long COVID because we don't know exactly what it is. It has been quite common throughout the pandemic, maybe somewhat less common now, but still a lot of people have long COVID. So we don't know how many really because there's no good definition of it yet. It's probably not one disease. But by recent study, it's estimated there are 4 million people who've been unable or have difficulty working because of long COVID. The number of people who've had long COVID is estimated to be 4 to 5 million, maybe more. So some of these people have what we call post-ICU syndrome, which is common to anybody who's been in an ICU for very long, and particularly people who've been on mechanical ventilation. But even people with mild COVID can get these prolonged symptoms. It seems that it's less frequent with people who are vaccinated. Maybe it's less frequent with mild disease, although that's hard to know. Maybe it's less frequent with antivirals. Again, That's not certain. It does seem to be that it's less common with the current variants that are going around. That may be because there's a lot of partial immunity, but we don't know yet. We don't know that for sure. So the symptoms of long COVID are almost anything, but the most common ones are fatigue, shortness of breath, cough, trouble sleeping, joint aches and pains, psychological stress, brain fog, anxiety. But most of the people who have what falls into these categories, most of the people say that it's interfering with their quality of life. In general, these are symptoms by definition that have lasted several weeks after an acute infection and can go on for weeks to months. But importantly, for most people, it does not go on forever. So this leads to the question, why is the emergency declaration ending? Well, the immediate reason is the House is about to vote on a bill called the Pandemic is Over Act, which would cease all programs that have been put in place because of the pandemic immediately. And the Biden administration wanted to give some breathing room to shut down these programs over a period of a few months. So that is why the White House is ending the declaration in May. It's really to buy a little bit more time. But beyond that, the adverse effects of the pandemic, even though the pandemic is not over, the adverse effects are subsiding. As we've seen, the impact on the healthcare system is less, and the impact on the society is less, where most people are, out and doing things again. The economy is, although the economy has other problems, it's not so much because of the pandemic. And so federal intervention is not needed as much as it was in the past. But this does not mean that COVID is going away. We don't expect COVID to entirely disappear. But at some point, you have to make a transition between the extraordinary measures that have been put in place over the last 3 years and normal times. So at some point, there has to be a return to normal and treat COVID like we treat other infectious diseases. So what goes away with the end of the emergency? So all the freebies from the government, the free testing, the free treatments, the free vaccines, they'll be going away. They'll still be available, but your insurance company or you will be paying for them. Many people will lose their Medicaid coverage. These are people who became eligible for Medicaid because of the federal programs that were put in place for the pandemic. Likewise, some benefits under Medicare Advantage plans, specifically for out-of-network care, those will be going away. And telehealth, which we've all used so much during the pandemic, will probably revert back to the way it was before the pandemic. The compensation for telehealth is the improved compensation for telehealth, which has enabled it to be used so much, will be reverting back to its previous state. And there are many other things too that are more minor and more technical. So what have we learned? So we learned that leadership is essential. When we look across the world at countries that have done relatively well in the pandemic, it is those countries that had strong, consistent national leadership that responded vigorously and instilled in their populations a great sense of trust. Those countries that did not have this have done relatively worse. So we've learned that CDC, which is a much esteemed organization prior to the pandemic, did not perform particularly well during the pandemic. And in part, it's because of the way the CDC is structured. And so it's now undergoing some restructuring and reinventing itself as a response agency, which it did not see itself as primarily before. We've learned that the lack of investment in state and local public health over decades has to be restored. We've learned that hospitals who know they have to prepare for disasters were not prepared for such a prolonged crisis. And so they need to now think about how they maintain their emergency operations for months, if not years on end. And we need a much more effective, coordinated healthcare response than what we've seen. We are going to need to bring on a whole new generation of healthcare and public health workers. So many have either quit or have announced that they are looking at quitting, that we're going to need to replace really a whole generation of new workers. We've learned that it's not just respiratory droplets that we have to worry about. We have to worry about aerosols. These are virus droplets that can stay suspended in the air for very long periods of time. And we've learned that masks and ventilation work and are vitally important. And we've learned about the dangers of mis and disinformation. So what happens next? I got my crystal ball. So foretelling the COVID future, COVID is not going away. I expect that it'll bounce around at its current level for a long time. We'll see some surges. The numbers will go down, they'll go back and forth. Maybe it'll be seasonal, maybe it won't be. But I think that COVID will be with us for a long time. But gradually, the severity of the illnesses, the average severity of the illnesses, and the incidence of long COVID, I think, will gradually decrease over the course of the coming years. But I do think that we will see annual COVID vaccinations being recommended starting in the fall. But it's not just COVID that we think about. We live in an age of epidemics, and there are a lot of reasons for that. One of them is climate change. So we are seeing, with increasing frequency and increasing geographic dispersion, vector-borne diseases, mosquito-borne diseases like dengue, Zika, chikungunya, West Nile malaria, encephalitis, yellow fever. These are all increasing in incidence and occurring in places where we have not seen them in recent years. Likewise, tick-borne diseases like Lyme disease are becoming much more common than they were as average temperatures increase. Same things for Chagas disease in the southwest, and many others. The other thing that is happening is human encroachment on wilderness. And so this is where things like Ebola, Marburg, monkeypox, Lassa, Nipah, hantavirus are all because people are going to where only wild animals were before. And so we're being exposed to the viruses and other pathogens that they carry. And we are now being infected by them. And because people are now being infected by these emerging pathogens, and with the ability for rapid air travel globally and huge megacities, we expect there to be more and more frequent outbreaks of these new pathogens. And more pandemics with flu, with coronaviruses. It's hard to know how severe they will be. But there's also then the unknown, the disease X. We are continuing, even though we have a good idea of diseases that are likely to cause epidemics, we don't know what we don't know. And so there is a good chance that we will be surprised by something that we didn't anticipate. And with that, I think I'm going to turn it over to Andrea next, and then we'll have questions at the end. And I'll stop sharing my screen.
All right. That'll be great. Thanks, Eric.
Thank you, Eric. Let's see here.
I'm good.
All right. Can you see the presentation okay?
Yep.
Yes.
Great. Well, good evening, everyone, and thanks for the invitation to present to you this evening. If I was there in person, I'd be seeing so many friendly and familiar faces. So thank you for allowing me to join this evening from the comforts of my own home. Let's just make sure. Okay. So prior to the pandemic, my friends and colleagues would hear me say that if your director of public health is in an incident command role, you know it's a bad day. Well, let's just chalk that up to a lot of bad, frustrating, uncertain days here in our county and beyond. But I would be remiss to, if I neglected to point out that March 2020, we had our first reported COVID case here in the county. And that was my team. I included a team of a team photo prior to the pandemic, all smiles. We're really excited about the new year in 2020, and surprise, the universe threw us a pandemic. And so I do want to point out that there, in some aspects, we were prepared for this pandemic. We have what's known as the Public Health Emergency Preparedness Program. I have been involved in that program here in this county for almost 11 and a half years, both from the behavioral health side and from the public health side. On February 29th, 2020, we held our Decker Fire Recovery Fair. And that's a photo of us in public health with Solvista Health preparing for the recovery fair. We are very much involved in our county's Emergency Services Council, a offshoot of our Incident Command System, which is Emergency Support Function 8, Health and Medical. Here in this county, public health takes the lead on ESF 8. We are heavily involved in the South Central Region Healthcare Coalition. I've actually served on the board of that healthcare coalition, mainly focused on emergency preparedness and response. I am a trained public information officer and have been for a good 11 and a half years. And then myself and my team and our community partners have years of required training, exercises, drills, and real life events. So while nothing to this magnitude, I would say that the most recent event prior to the pandemic was our Decker Fire response. So I'd like to break the pandemic into sort of years or chapters in kind of my mindset. And year one was all about prevention, mitigation, and ultimately, believe it or not, saving lives. There was not a day that went by that I wasn't talking to the coroner and to EMS director, to the hospital's emergency response team, as well as many of the other sectors that were impacted by the pandemic. So that response included intensive case investigation, communications. So early on, we established a Facebook page. We held regular town halls. I did a Facebook Live update every day at noon. We put up message boards because we know that technology isn't readily available to everyone in this county. We conducted interviews through radio, print newspaper, online newspaper, and I think I have logged over 100 press releases in the last 3 years. We were early adopters in PCR testing as well. So while many of my colleagues in other counties were hesitant to take on PCR testing, we jumped in just without looking back. Ultimately, other providers did take on PCR testing alongside us. Personal protective equipment distribution was really important, and our plans had always included a sizable distribution from the strategic national stockpile, and come to find out that stockpile wasn't as grandiose as we had anticipated. And so we really had to be thoughtful about how we acquired and distributed ample supplies of PPE out to our community partners. As you may recall, we held masking events in which we distributed a lot of homemade cloth, and then, of course, the various more medical grade masks throughout the county. As you'll recall, we had a very painful moment in time in March and April and May where we were dealing with closures and then reopenings. This concept of distancing was new to many of us. And so having to navigate all of the varying elements of the public health orders as the goalposts kept on changing on us. What I'm really proud of is our leadership roundtable that at one point comprised of over 50 county leaders that met on a daily, and then we scaled back to a less frequent cadence. But up until December 2022, we were meeting on a regular basis. That was an opportunity for me to inform our community leaders of what was going on in our county and beyond as far as COVID, and then of course, some of the other communicable diseases that Dr. Toner mentioned. And then it was also an opportunity for us to discuss public health orders before they were shared publicly, and just gave us a safe place where we could put our heads together as thought partners and work together in our response rather than in silos. We also spent a lot of time and effort protecting our most vulnerable, specifically Columbine Manor. And as you'll recall, early on in the pandemic, our older residents, especially those related to Columbine Manor, were the ones that were dramatically hit by the virus, as well as had their greatest share of unfortunate deaths as well. And then, as Dr. Toner mentioned, this ongoing loss of public health leadership. My colleagues were retiring, they were getting fired, they were disappearing quickly. And that, because of that, we lost a lot of institutional knowledge, a lot of support for each other. It was a really scary time to be a public health leader, as there were infinite threats against ourselves, our families, our staff, our buildings, and so forth. And so as of today, I think the latest report that I reviewed today said that there's been about a 50% turnover in public health leadership in our state since the beginning of the pandemic. And if you look all around us in Chaffee County, 2 out of the 7, no, 3, including me, out of the 7 public health directors are still here. Year 2, the great vaccination. I remember one morning when I was working out, and it came on the news that the vaccine was coming to us, coming to our state, coming to our county. And it was a moment of overwhelm and hope and true excitement. Well, who knew that the great vaccination wouldn't go as smooth as we had hoped? As you may recall, there were phases of distribution that put a strain on public health and our healthcare system. It was really hard to look in the eye of my neighbor, of my friend, who considered themselves high risk, and to say, ethically, we can't distribute this life-saving vaccine to you. those were dark days, but eventually we were able to vaccinate everyone who wanted to get a vaccine. And the clue to kind of abort mass vaccination events was at our last mass vaccination event, there were more out-of-towners coming to Chaffee County because they heard it was easy to get a vaccine than there were locals. And I was like, okay, we need to bring vaccination in-house and normalize this into regular vaccine distribution. And so we definitely coordinated and collaborated with all of our healthcare partners. And then, this word of getting a booster on deck and kind of those nuances we dealt with in year 2, as well as our Thanksgiving gift, which was the Omicron variant. I think just as we were all hoping that, we got fully vaccinated, we got our booster, we did all the right things, and we were really excited to spend, many of us, holidays with our families for the first time in a long time. And here comes Omicron. So just year 3 in reflection, and year 3 really has been last year in 2022, but I think it does bleed over into 2023 as well. I'm calling it the Great Reconnection. There's so much hope and promise, and yet we still have to do a lot of fancy footwork at this stage. So I've been using the term routine disease control and normalizing this virus for some time now, for the last year or so. Come to find out, it is easier said than done. So I think we're still at that stage where we're trying to figure out, what does routine disease control with a novel virus that has thrown us so many curveballs look like? Also, Omicron's many subvariants. Omicron's what we were hoping for, and it's difficult to monitor when we keep on seeing all of these subvariants in the news and in the media, and people want to know, what does this mean for them? What does immune escape look like? Is it more transmissible or not? Is it more severe? And then, of course, we have seen a rise in other communicable disease reporting and outbreaks. We had to pivot in mid-year in 2022 due to, at least for us in our department, Ebola, polio, Mpox, which was called monkeypox, RSV, and influenza. I am happy to say that while we experienced an unprecedented peak of RSV in our community in the fall and winter, that the hospital is now reporting only a few pediatric cases here and there. And then we had an early flu season this year, and there was a while in which we thought that we would see a second wave. And what we're hearing is that that's probably unlikely here in Colorado due to a significant uptick in the 65 and older population for the flu vaccine, and that it is doing it. And again, I've said, just this turnover, building and rebuilding our public health system, our general health system, establishing trust and relationships again, and this profound yearning for social connection can't be understated. I think that while we fared really well here in Chaffee County, we are a social county. On any given day, night, weekend, there are lots of events to participate in, lots of activities. And even when people have been participating in them, there's been this kind of overarching feeling of anxiety and fear of COVID, as well as just getting sick in general. And so as we are embarking upon year 4 and beyond, where do we go from here as a county? And so I just really wanted to point out that if you're not following the data, we in Chaffee County have, for the most part, since the CDC data dashboard got launched, we have had a low community level. And so that takes into consideration transmission and hospitalizations. We have had a really tough time keeping transmission under control. So for the majority of the time, we've been in high transmission, and we've kind of gone back and forth between high and substantial depending on the week. However, like Dr. Toner said, there are limitations to this data. It gives a snapshot, but truly doesn't tell the whole COVID picture in our community. And because it's population-based, we can be a high level, even if we've had 8 to 10 cases in our county. So with a population of 20,000, that's relatively healthy. We just have to take that data for what it is, but also match that with other data sets and anecdotal data from throughout our county. Hospitalizations and deaths have been nominal lately. At the beginning of the pandemic, clearly we saw more hospitalizations and deaths. And then we saw a trend of hospitalizations with COVID, but not necessarily due to COVID. We've had 56 deaths that have been known to me over the course of 3+ years. And we did just recently get reported of a death with COVID of a 75-year-old from our county. So we're not out of the woods. And I think that this is just coming to terms with our new normal. Believe it or not, if you do test positive, there still are isolation protocols, and we try to walk people through that every day. And then the quarantine protocols, while they were pretty hefty of a hit early on in the pandemic and for the first 2 years, those have really loosened as well. And so you may have seen several campaigns from throughout the county, really just wanting to educate people on the importance of staying home when you're sick, washing your hands, getting tested when it's appropriate, getting the vaccine, and so forth. That has really been our main message as of late. And then when people ask me, what should I do, Andrea? We have a discussion about, well, do you consider yourself high risk? And what is your risk tolerance? And what was that risk tolerance prior to COVID? And what did you do then? So just trying to take a real reasonable, personalized approach, understanding that we each have our own personal and professional relationship with this particular virus. Clearly, our effort continues with vaccine and boosters. We have the vaccine bus that's been traveling around the county in all 3 of the major municipalities, and that will continue through mid-May. We continue to offer vaccine in a myriad of ways, so there's no shortage of vaccine at this time. And same with testing. I was covering our front desk last week because my admin team was at a conference, and let me tell you, our free rapid antigen tests are flying off the shelves. And so they are certainly continue to be in high demand. As we've already discussed, the end of the emergency declaration. And really, how do we incorporate a new virus into our lives indefinitely? And so some of these themes are just repeats, but certainly from my heart, we need to attract and retain a well-compensated public health and healthcare system. We need to ensure that we have a healthy supply of PPE, and that supply expires. And so how do we replenish it as the expiration date arises? Looking at how do we secure and distribute free rapid COVID tests while it's still recommended to use them. In very few cases do we, especially as public health, recommend rapid testing or PCR testing for that matter for regular influenza and for strep. Only in those most severe cases and hospitalizations do we tend to test here. So, as we're thinking about normalization, what does that look like for this particular virus? I can't imagine a day in which we are blowing through as many rapid tests as we are at this moment in time. Promoting better ventilation, revisiting incident command role. So as your incident commander for, well over 2.5 years, there's really no redundancy if something happens to that incident commander in our public health structure. However, in a wildfire, as you may know, there's usually 2 weeks on, 2 weeks off, 2 weeks on, 2 weeks off. Well, come to find out, for a 3-year pandemic, there is no break for an incident commander. And so we need to think through, what does that incident command structure role look like, and what are reasonable expectations? We really need to strengthen the relationship between local public health, the Colorado Department of Public Health and Environment, and the governor's office. And we really also need to take what was written in our after action reports and apply it to the future. You can see a photo of my team in all elements, COVID testing at the fairgrounds, day in and day out, in all kinds of weather. I do not think we need to go back to that day. And so lots of lessons learned. And I think, that strikes a chord from Dr. Toner, in which the importance of strong and unwavering leadership. It's really been the key ingredient to success here in our county. Not all counties fared well during the pandemic, and I think we should be really proud of our leadership here. Commissioner Greg Felt was my right-hand person. We were talking on the phone or meeting, sometimes 3 times a day, morning, noon, and night, on weekends, just to make sure that we were aligned with everything, all of the dynamics that were going on locally, at the state, and beyond. Our other 2 commissioners also provided a lot of support, leadership, and at times just a sounding board for our county's leadership group. In all of our planning, we did not include an inject that said your pandemic will become political. Now we know. As well as, thinking about just a basic understanding and support of public health and prevention measures. That's imperative. At no point in the pandemic did I ever mean to make someone uncomfortable or frustrated or angry because we were asking them to wear a mask or to distance or to maybe opt out of an activity. But it certainly at times became very heated and uncomfortable. Communications in all of the planning and exercises that I've participated in, when we write our after action report, communication, even when you think you've nailed it, is always an opportunity for improvement. And so we will certainly take that into consideration in the future. And social media in our community was a blessing and a curse, and it continues to be so. And so we just need to think about that tool thoughtfully and with respect to the people that it's about. And public health orders. I had never had to write a public health order or promote it. And come to find out, they are hard to enforce because we're depending on altruism. And unfortunately, ego comes into play there. I have so many other lessons learned, but those are the main ones that came to mind. And so frequently people ask me, we didn't know about public health before the pandemic. What did you do before the pandemic? more than just pandemic response. Trust me. And so I just listed out some of our programs here at Chaffee County Public Health. They're always increasing, improving. We're always looking at how we can meet the needs of our community. We do that through community health assessments and improvement plans. And lastly, I just wanted to show you what we have been up to in 2022. We took our COVID emergency response trailer and we turned it into Chaffee Community Clinic. So that's a free mobile health clinic that is at the Salida Methodist Church on Mondays from noon to 4, as well as the Buena Vista Community Center on Tuesdays from 1 to 4. We provide harm reduction, STI, HIV testing, oral health screenings, cancer screenings, lots of behavioral health navigation, all for free. And that's my amazing team welcoming clients to Chaffee Community Clinic. And this was the latest team photo that we took in late summer, early fall 2022. This amazing team has gotten us through some really tough times here in Chaffee County, and we're here for all of you. So if you ever have any ideas on needs that are going unmet, projects that don't seem to be being picked up by any other organization or agency, reach out to me. I'm happy to do some thought partnering with you. I often tell community members, pitch me an idea and find me a funding source and we'll talk. So really, we're here as public health just to make sure that everyone in Chaffee County, whether they're a resident or a visitor, has the resources and supports needed to thrive in health and wellness. I truly believe that we can be the best place to thrive in health and wellness. And that's my contact information, just in case you don't have it.
All right. Great. Well, everybody should have cards. So if you have questions, hand them in to Karen, and we will let our presenters, thank you very much for some great and thoughtful ideas about where we've been and where we might be going. All right, and we'll get started. I'll start with these and Karen can keep. Okay, oh, here we go. This I'm guessing is probably for Eric. This person wants to know if you're familiar with the book Spillover, which I believe is, correct me if I'm wrong, it's looking at reservoirs of infection or new diseases that are coming from the animal world. Are you familiar with Spillover?
I'm familiar with it. I've not read it, so I can't do a review of it, but I am familiar with the idea. And spillover is, it is a concept that we endorse, and is clearly the cause of so many of the emerging epidemics that we've seen.
All right, and it said, I've got another question for, I think, Eric, on what is the recommendation for wearing masks during a pandemic? Is there evidence that wearing a mask keeps the disease from spreading, and what kind of mask is best?
Yeah, so the evidence for the effectiveness of various kinds of masks is very strong. So for medical grade masks, so an N95 or equivalent mask, if properly fitted and properly utilized, provides extraordinary protection, both to you as the wearer and to the people around you, protection from you if you're infected. Other kinds of masks, surgical masks, and particularly some of the over-the-counter masks are much less effective. They do an okay job of preventing you from spreading the infection to others. They don't provide a lot of protection to you as the wearer. But it's better than nothing. And all of them are probably better than a simple cloth mask, and definitely better than a bandana.
All right, and then also they wanted to know if a test has expired, can it still be used for several months afterwards? And that's probably for Eric also.
I have personally done that, and have seen a positive result from an expired test. But obviously, I can't. Better to have one that hasn't expired, but they still can be effective for a while. Who knows how long?
Right.
Let's go ahead and chime in that we have a plethora of rapid at-home tests here in the county for free. And so if you're in a place where you're trying to decide expired versus not, just call us. We have plenty for you. Have not yet expired. We actually just invested in another significant number of tests.
Good to know. Thank you. Okay, here's a question on saying, can you speak more, and this is probably also for Eric, about the changes in the CDC to reinvent itself as a response agency? Can you talk a little bit more about what that exactly means and what the concerns were?
Yeah, so we don't know a lot of the details yet about how this is going to play out. So they're going through a process now of trying to figure out what changes actually are needed. But the CDC has seen itself for a long time as primarily a research organization, very academic, very siloed, many different centers within the Centers for Disease Control. And they, except for a very small group within the CDC, have not seen themselves as first responders. And it's clear that now that needs to change. They need to be much more nimble. They need to be much more coordinated, and they need to see themselves differently. And their leadership has adopted that and is going forward with that. It'll be a painful process because it is such an old organization that is very set in its ways.
All right, thank you. Okay, this is for Chaffee County. So can you talk a little bit about programs and strategies to support the mental health of our youth post-COVID? Because we know that being home and missing school and not being able to be with friends, we know this was a very tough time for kids and teenagers.
Yeah, great question. So pre-pandemic, we were having discussions about behavioral health as a public health crisis, especially in our youth. So this discussion isn't unique to the pandemic, but certainly the pandemic exacerbated mental health needs in our county. We have been working closely with our school districts, with Solvista Health, and also with funders such as the El Pomar Foundation to bring in greater resources and supports. Solvista Health does have school-based clinicians, and I'm hearing that they're being highly used, as well as Partnership for Community Action is in our schools as well, providing pro-social activities and the like. We also are fortunate here in this county that we do have an abundant array of outdoor activities that proved to be safe during the pandemic. And so those groups, whether it's the mountain bike team or some of the groups that get together on Fridays, really been in high demand. And I think what we'll start to see is these agencies being trained in youth mental health first aid. That's a course that we provide currently adults and service providers who work with younger people with tools in their tool belt to identify signs and symptoms of mental health crises in youth. And so there's a lot going on in the youth mental health landscape. And I'm grateful that we live here in this county because we were already partnering on so many other projects, the Extraordinary Youth Council, mentor programs. And so we do have a strong infrastructure, and we're looking at expanding it to meet the needs of our youth. We've also identified youth mental health as a top priority in our community health improvement plan.
All right, here's an interesting one. I think this is for Eric on how do you see the lab leak theory or the animal transfer theory for this virus? And I'm going to add on to that. And why does the Department of Energy think they know?
Well, I'll take that second part first. So the Department of Energy runs major laboratories. The national labs are part of the Department of Energy, and all the national labs, most of them at least, have departments that now work on biological threats as well as nuclear threats, which is what they were established for. And so they collaborate with other national laboratories around the world. So that's why they think they know something about this. What is the real answer? I think the real answer is we will never know where this came from. It is plausible that it came from a lab leak. It is plausible that workers from the laboratory became infected and then transmitted it to family and friends and eventually into the community. That is plausible. It's also quite plausible that it came from infected animals in in the Hunan market there where the first outbreak was centered. The reason we won't know is because a lot of the evidence was destroyed. China said that they sanitized the animal market, and so there are no specimens left. They said they did it for public health reasons, which makes some sense, but there is no evidence to look back at, so we'll never know for sure.
Okay, and one other one for probably you, Eric, is what do you think of reports of people having strokes or heart attacks or AFib after getting a COVID vaccine?
The incidence of those things is probably much less than the incidence of people who've not been vaccinated. Those things are all those things are known complications of COVID infection. So strokes, heart attacks, blood clots, myocarditis, endocarditis, pericarditis, all these different kinds of inflammatory diseases in and around the heart and in blood vessels elsewhere are known complications of COVID. So if one got, and they also happen having nothing to do with COVID. So it is quite likely that someone's been vaccinated and in a period of days, weeks, or months afterwards had one of these complications. When this has been looked into, the incidence in people who've been vaccinated is no higher than the incidence in the general population.
All righty. Okay. Let's see. Andrea, what was your employee turnover rate in the last 3 years? And are you getting more funding now for disease control?
We had 0 turnover rate except for anticipated retirements and letting our contact tracing staff go, and it didn't make sense to hold that responsibility locally. So we have actually grown in staff since the pandemic because we've created so many new programs. What was the second part of that? Oh, funding. You know, we have historically had a very complex payer mix to fund our department. Typically, our county subsidizes only 18% of our budget. The remaining is grants. And so we have been the recipient of emergency response funding, ARPA funding, and I think at the state level and hopefully federal level, but I'm more attached to our state, being on the board of the Colorado Local Association of Local Public Health Officials, we're advocating for a more sustainable, ongoing funding stream to fund our public health system. And so I'm advocating specifically for our rural areas to be able to count on that funding moving forward and to have it be incorporated into our master contract. So funding for public health, at least in our state and for our county, is looking favorable more so than ever before.
All right, thanks. There's another question just about, I think this is probably for Eric, that it's this person's understanding that most pharmaceutical companies do their own studies and give funding to those. And then, so there's a question that do vaccine developers do their own studies, or were there any totally independent scientists who looked or reviewed those studies before they approved the vaccine?
Yeah, so the studies are done by either the companies themselves or often people in scientists in universities who are funded by the companies. They are the ones who have the responsibility for doing the testing. All the data that's collected is reviewed by the FDA and by an external independent panel associated with the FDA. So for drugs and vaccines that we use in the United States, they have been very carefully vetted, and their studies have been very carefully vetted. So I have a lot of confidence in the validity of the tests that have been done.
And a second one for you, is there a possibility that some blood types are more susceptible to COVID than others?
So there's a theory that people with type O blood are less susceptible to COVID. There have been studies of this, and it's not so clear that that's actually the case. But since that's my blood type, I'd like to think so.
Me too, and I have
Okay. Okay. What preparations, this could be for both of you, but what preparations should be or are being made for the next pandemic? I'm going to give that to you because I know you worry about that sort of thing, Eric, each and every day.
Yeah. So right now, the Congress is working on reauthorizing the Pandemic and All Hazards Preparedness Act, the bill that essentially funds all of the preparedness work that's done in the country. And so it's, we are in the midst of trying to figure out what should be tweaked in the bill and hope that the House of Representatives doesn't get in the way of passing reauthorization, because there have been some inkling that some may want to do that, and that would totally decimate all the preparedness work that's gone on. So that would be awful. But in terms of trying to learn the lessons and trying to improve programs, definitely there's a lot of work being done by our center, by many other centers within the government. We're working on things related to better masks and respirators. We're working on issues related to healthcare surge capacity. We're working on a lot of issues related to public health preparedness and rebuilding the public health infrastructure. There's plenty of work to be done. And I think we have a pretty good indication or pretty good idea of what the work is, but getting it done and getting it funded is going to be the challenge.
All right. And just the last couple of questions that I think are pretty brief. So Eric, do you think we'll have a flu COVID combo vaccine? We do.
I think it's likely, yes. Whether it'll be this fall, I'm not sure, but I think that's likely.
That's good. And finally, is there any medication that has been seen as helpful for long-term COVID brain fog?
No.
Yeah, simple answer. All right. Well, we know it's late East Coast time. It's 9:30 at night. So we will thank you both so much for taking the time and talking to us and enjoying very much. So I'd love to show you this large room full of people who all came out and had a chance to participate together. We're having a post-COVID experience here, Andrea. So anyway, thank you all very much.
Thanks, everyone.
Okay.
Have a great
Bye-bye.
night.
Bye-bye. Take care.
Do I just hit end for the recording?
Please leave your name tags there, and there are